Good afternoon. You're with me, Tanima Biswas, and our top story. India has locked horns with WHO over its methodology of calculating COVID death toll and claimed that different yardsticks have been applied for different countries. India's reaction follows an NYT article which claimed that India is trying to stall a WHO report on global COVID death toll. As per the report, World Health Organization claims 15 million people have died of COVID globally, which is double the official figure which has been given by all the countries. The New York Times article also goes on to say that WHO has estimated that a third of this excess, which they have calculated, 9 million, a third of that, which is roughly around 4 million, are actually from India. Among its objections raised, India has said that the same methodology cannot be used for smaller countries and for a country with 1 billion people like India. I'm joined on the discussion by Dr. Suneela Garg, who's a member of the Lancet Commission and also a member of the National COVID Task Force. Dr. Garg, thank you so much for joining us here on Mirror Now. Firstly, what are your thoughts on this New York Times article, and specifically the WHO article, actually the WHO part, which NYT quotes, where they are essentially saying that the estimated COVID death toll in India and also globally is much higher than what the official report suggests?
See, thank you so much. First of all, I'd like to comment upon that this is not a correct way of estimating the deaths. Now, we have got two types of reports from WHO. One is for tier 1 countries, another is for tier 2 countries, where India is clubbed with Bangladesh, Tunisia, and all those countries. So, and that which is based on modeling, and for other countries, it is based on the projections which they have given. So it is absolutely a very wrong statement. We have to go country by country and look at their own, estimates, and then accordingly we have to calculate. So that is where WHO cannot just comment on a large country like India, which has got, we have got today 1.38 crores roughly the population, and we also know that few pictures which have been shown in media or something like that, I feel that, that cannot determine what is the extent of mortality in India. So we have to go in a proper scientific manner and look at it. But we cannot say that India has reported that much has got that much underestimate. So we have to, go in a very systematic manner before we comment upon anything. And it would have been much appreciated if the meeting would have been called of different health ministries and then looked upon and then commented upon. Because from a public health perspective, you cannot just make a modeling which is not, appropriate model. You cannot compare the larger countries with the smaller countries. You cannot discriminate between tier 1 countries and tier 2 countries, because we all know that with a big population, we had, comparatively much lesser number of deaths, but definitely, Registrar General of India would be one of the methods, where we are looking at, but we strongly, condemn this kind of report. So we need to look at it very, very correctly from India's perspective. And we have to be in line with, exactly how much are the number of deaths. So I think that this model is not applicable to India, number one. Number two is that, before commenting on a country, I think it is better to have the correct estimates of the country.
Right. On the discussion on the show, I'm also joined by Dr. Rajiv Dasgupta, who's also a member of the National COVID Task Force. Thank you so much, sir, for joining us. I was just taking an initial response from Dr. Suneela Garg about the methodology that WHO has used. And India has also registered already its objections in a series of letters, essentially saying, how is it that we are using the same methodology, first of all, to judge various countries with different population sizes? And secondly, also essentially saying that, the methodology used by WHO to calculate the COVID death toll globally, not just for India, is flawed. What would you say?
Thank you. All modeling methodologies are open to debate. And in fact, these debates can never be very convincingly closed on either side. That's inherent in the nature of the modeling business. However, it would also not be proper to attribute that modelers do not take variations into account. Now, the WHO has a global task of estimating mortalities at various stages of the pandemic. Now, it's extremely crucial to understand that adjusting for the stage of pandemic in each setting is essential. Uh, in fact, the very high mortality early on in the European countries, Italy, Spain, and so on, wouldn't be comparable today even to what's happening in those countries now, for the simple reason diagnostics have changed, treatments have changed, and so on. But essentially, here, what WHO is seeking to do is to look at the overall impact of the COVID pandemic. And therefore, it is also taking into account, uh, say, for example, deaths that are attributed to treatment delays. Now, therefore, I think a fine distinction needs to be made into understanding that these are not estimates of direct COVID deaths, over which also various countries, let's remember, haven't exactly followed the WHO methodology that was set out uh, quite coincidentally, exactly 2 years to the date, 16th April 2020. Even countries deviated from that. Nevertheless, those are direct COVID mortalities. And here, what it's seeking to understand is what the pandemic has done to mortality in general. And therefore, these are not really directly comparable.
That is what India seems to be making a case. To Dr. Garg as well as Dr. Dasgupta, we've seen that this debate has risen from time to time, essentially questioning the official data. Obviously, in every case for that matter, we have seen in the past in several instances, not just for COVID or the pandemic, that official data when it comes to such cases is always under question, under scanner. But time and again, we've seen actually India in a way refuting some of these reports which have come through, especially whether it's from the global media or from some global body about the estimates, the death estimates linked to the pandemic, which have been put out. Do you think that maybe for the government also, they need to convey exactly the method that they are following or the records that they are actually looking at while assessing this total figure, in a way get into a proper dialogue with the WHO about this? Because the WHO is, of course, following its whole methodology, which it's using for all the countries, not just for India. But there needs to be a clearer dialogue so that this confused message is not set out in the public domain.
Definitely. This is what I was telling, that before, we come to this, we have to have proper dialogue. What estimates, what is the method which is being used? Because you see, in between, if you'll remember, when this was the case, even ICMR came out clearly with the guidelines of, how to do with the death certificates and all that. Not that we were not cognizant of this fact. And definitely, as has been pointing out, we need to look at, exactly, though models are important, but for different countries, you see, you cannot make different assumptions. That is one thing which we have to keep in mind. So definitely WHO and different countries have to have a dialogue, and we have to have a kind of a strategy based on the treatment protocols, based on, the comorbidities, how the person died. Primarily, it was because of COVID or it was because of some other condition. All these things are going to matter. So that is why, I said Registrar General of India, plays a very, very critical role, and WHO should take that also in cognizance along with the Ministry of Health.
Right. Closing remarks first, actually, from both sides that I will take. Dr. Dasgupta, first you. What do you think should be the way out, to come up with, how should we deal with this matter? Because from time and again, we can see that, whether it's a global body or whether it's a global media house, which is actually coming up with such a report saying maybe the actual figures are being buried, or there needs to be an assessment in terms of the COVID death-linked figures. And this also brings up other questions which, political leaders like Rahul Gandhi also raise in terms of compensation, which needs to be given. So in order to actually look at this issue as a, in a solution, to find a solution to this issue, what exactly does the government need to do? The first step, besides the dialogue, of course, with WHO, which needs to be done. This is the WHO report that we are talking about. Any other step that the government can take from their side in order to reassure, whether it's the public at large or also in terms of some of these questions which are being raised by different sections of society about the COVID-linked official data?
Well, India is an extremely important and valued member of the WHO system. India certainly plays an extremely important leadership role, not just within the Southeast Asian region, but also the WHO as a whole. And therefore, rather than any confrontation emerging, it should be one of global cooperation. And the pandemic has shown how valuable, how crucial cooperation is. And that cooperation, as we have seen, for example, in the case of vaccines, is equally crucial in the realm of data. And without cooperation, this just can't move forward. Also, models or modelers, just because it comes with certain constraints, can't and shouldn't be condemned outright each time. It's important to understand the strengths and limitations of a model and then frame responses or frame strategies within those. And as Professor Garg said, India is a large country with extremely robust public and private institutions. We should also be looking very objectively at what the COVID impact has been in various facets, including mortality in this country. And that should really set benchmarks in the region and perhaps in the world as a whole.
Right. Dr. Garg, any last comments from you on this?
I think it is very important to relook at the whole statement, primarily, and as has been pointed out, that models are important, but we need to look at, how the models have been before, coming at the, when we derive these conclusions, these should have been shared with the countries also. This is how we are using this. So primarily, this is where we need to, so-called, as has been pointed out also, that we are a large country and we are an important country from the UN perspective also, with regard to not only the treatment protocols, vaccines, or supply of medications and all that. So it is very important to have a uniform strategy. Of course, one size will not fit all, but definitely India also has. That's why they said that we will look at the estimates, of the number of deaths which happened during that period, with the Registrar General of India's office. But then, at a national level or at an international level, definitely, a dialogue has to be held. And along with that, the model has to be re-looked into. So that is where, before coming out with any of the results, we need to take all these facts into, consideration, rather than, fitting, one size will never fit all. That is it.
That's exactly. The debate was about the one size not fitting all approach should not be taken. That is what India has, in fact, mainly tried to convey to WHO. Dr. Suneela Garg and Dr. Rajiv Das Gupta, thank you so much for joining me on this discussion.